basically, the SAFE trial has been published this year in the JAMA Oncology as an interim analysis. It's a 4-arm randomized phase 3 double-blind placebo-controlled study. The main objective is to determine whether a pharmacological cardioprevention could reduce subclinical heart damage in breast cancer patients treated with an anthracycline-based chemotherapy with or without trastuzumab. The subgroup analysis that we presented at San Antonio Breast Cancer Symposium this year basically focused on the impact of post-operative breast radiation therapy on this recently published pre-specified interim analysis on around 174 patients who had completed the cardiac assessment at 12 months. The cardioprotective therapy was based in bisoprolol, ramipril, or both drugs, as compared to placebo that was administered for 1 year from the initiation of chemotherapy or until the end of trastuzumab therapy in case of HER2-positive patients. And the primary endpoint was defined as a detection of any subclinical impairment, so worsening or more than 10% in myocardial dysfunction and deformation as measured by three-dimensional left ventricular ejection fraction and global longitudinal strain. Our main results, basically, at this interim analysis, a cardioprotective pharmacological strategy in patients affected by breast cancer receiving an anthracycline-based chemotherapy seems to be well tolerated and seems to protect against cancer therapy-related left ventricular ejection fraction decline and heart remodeling. This favorable effect seems to be reduced in patients receiving postoperative left-sided breast radiation therapy, thus basically calling for further investigations on a potential radio-induced early subclinical heart damage. However, please take in account that we presented that the only significant feature related to global longitudinal strain and global longitudinal strain or three-dimensional left ventricular ejection fraction worsening more than 10% was represented by the placebo arm of the SAFE trial, thus basically confirming the crucial role of a cardioprotection for patients affected by breast cancer receiving an adjuvant anthracycline-based chemotherapy.